Hello, everybody. Thank you for joining us. My name is Brady Bagwan. I lead the Human Resources function for Morgan Truck Body. I'm joined today by Lisa Johnson, who is a Senior HR Manager for Morgan Corporation or Morgan Truck Body, and also Doug Sanders, a member of our Environmental Health and Safety team, and who is also our Industrial Hygienist. Lisa and Doug, thank you very much for taking the time to join us here today and sharing some of the best practices that we've found over the last 14, 15 months since the beginning of the pandemic. So we didn't have the luxury, if you can call it a luxury, to work remotely because we're a critical manufacturing operation. So from the very beginning of the pandemic, we had to learn on the fly how to keep our team members safe and ensure that the business could continue its operation. So thank you in advance for your time today in sharing some of the most important mitigation practices that, from our experience since the beginning of the pandemic, have been the most useful. So some of the items that we're going to be covering here today, this is what we'll be reviewing very quickly at a very high level, but these are the most important things that both Doug and Lisa feel have been the most impactful for the company. Hopefully it's useful for you and your organization and you find it helpful. So the first piece there, Coronavirus Mitigation Playbook. Lisa, can you just give us a high level of what this is?
Sure. It was back in May of 2000, we came up with the Coronavirus Response Protocol Playbook. We developed it. It's a 68-page document that we provided to all leaders to give them step-by-step instructions and to try to help mitigate any confusion of what should be done in the event of a situation.
And that's May of 2020, right?
Correct, yes.
Perfect. So this is just a screenshot of the table of contents or most of the table of contents. Is that correct?
Yep. It's, part of the table of contents. Actually, what we tried to focus in on, the three key steps were training of all of our team members, prevention, and containment. Those were the three top issues in the playbook.
And that's effectively the strategy we set out with, right? That the big buckets that we based all of our actions on.
Correct.
And of course, this was pre-vaccine. And so
Yes.
we'll be wrapping up with some thoughts on the vaccine later on in this presentation. And on the call-off procedure, one of the things other than having a playbook and the various steps and details associated with that, we felt that this was one of the more important things that we did to help control the infection rate within our company?
We did. We provided all team members with a little pocket card that would be the call-off number. If anyone would have any type of a unexpected absence, they would call this number. It's a centralized number. It could be monitored by HR in any site, managers, supervisors. And what this did is if there was any COVID-related absence, it would trigger the site leader, the supervisor or manager to begin the viral symptom form that we could track and keep track of all the team members that may have been exposed to or experiencing symptoms of COVID-19.
So a central call-off line for the entire company, why not leave it to the individual supervisor of the individual at the various locations in North America?
We wanted to have it centralized so that it could be controlled and that one site wouldn't do one thing and another site would do something different. So we actually have Doug, myself, and our nurse that would actually be able to monitor this and keep track of all the call-offs so that we didn't inadvertently miss somebody in one of the facilities that may have a COVID-related situation.
Okay, perfect. Thank you. So Doug, if somebody called off or we otherwise found out, or if someone self-reported that they might, have some type of COVID-related issue, can you talk to us about what the next steps are?
Sure. A member of the pandemic response team, who Lisa just mentioned, would receive a viral symptom form completed from the HR department from that particular facility. Some of the key items on this form, and obviously all of this information was kept confidential between the core team. We would actually assign a confidential number. The information that was important, certainly some of the items were the date of the particular symptoms, who the team member may have been in close contact with, as far as in the work area itself, potentially where they think they may have gotten it, the symptoms that they may have been experiencing, temperature at the onset. And down at the bottom there, we have some more response type items, a recommendation that perhaps they either get tested or be sent out for quarantine to their home for the 14-day time period at the onset. And then we would obviously take this information and review it daily. If a team member came back to work because they either tested negative or they had gone through their quarantine, it would help us track their return date.
So one of the things not on the agenda, Doug, that I think I heard you say in this explanation is this form effectively initiates our internal tracing process. Is that correct?
That is correct. There's a lot of key information here, and I go back to either the date of symptom or the date that they may have been in close contact with somebody outside of work. Those were key items that helped us effectively behind the scenes help determine when someone could return to the workplace safely.
So as part of the containment piece or the containment prong of our COVID mitigation strategy, we start with prevention, try to keep it out of the facility. We've got somebody that's been exposed. Now we need to contain it. Our tracing and this viral symptom form are key elements of that process.
That is correct.
Perfect. So now, one of the items that you and Lisa had mentioned to me as being key, in parallel with our tracing, is this daily work readiness screening. Can you tell us what this is about?
Sure. Our daily work readiness screening is really a two-part process. It's taking the temperature of the team member, but it's also asking them, we started out with 5 questions. We revised later on to 6 questions, but it's a two-part process. And the flow diagram gives the site gives them the information as to what to do. Number one, if a team member would have an elevated temperature over 100.3, or if they answer one of the questions or more than one of the questions, yes, that they may have had close contact to someone, they may have some symptoms such as coughing for a prolonged period. And this allowed us, from the HR standpoint, to send the person home, and then the HR person would contact them and get that viral symptom form completed in a very timely manner.
Perfect. And that's really what this magnification or blow up is of the bottom of the process map, is the temperature on one side and the screening questions on the other?
Correct.
Perfect. Thank you. And so, going into 2021, we had yet another mitigation step or tool at our disposal, which was vaccination against COVID-19. Lisa, can you tell us, what the company did to, take a position on vaccination?
Sure. To help support team members, the hourly team members financially so that they didn't lose any income for going to receive their vaccinations, we did provide paid time off for the team members that got vaccinated. Once they provided their vaccination card, they would get up to 4 hours of paid time off. And also were available, the company sponsored vaccination clinics where they were available. Once the team, I'm sorry.
I was just going to say, it was at 4 hours per shot, right? If they got a 2-shot regimen?
Yes, correct.
And this is in addition to the standard paid time off programs. This was an additional program specific to the vaccination.
Yes, that's correct.
Okay, great.
And then we also provided T-shirts as a thank you for the team members to get vaccinated once they've completed their vaccination series.
And then as far as the factory floor environment, did we, how do you know if someone's vaccinated on the factory floor?
We did provide small hard hat stickers that said, I've done my part, and they could display those on their hard hats.
Perfect. So I think that's the conclusion of the, the best practices that we felt were the most impactful for our business. We should have probably started with, the fact that our infection rate within our company which has a national footprint, has always lagged or been better than the national infection rate. And that's a key metric that we've been watching since the very beginning. So these are the major components that we felt had the most impact in those results. And of course, the tracing internally to the company, depending on the jurisdiction that we operate in, there's no way that we could rely on the county health agency. Some counties where we operate don't have a health department. So the internal company tracing was critical in our efforts to mitigate and contain the virus. But obviously we start with team member training and prevention before containment. So Lisa and Doug, thank you so much for taking time out of your busy day to help share some good knowledge that we've found to be very valuable. And I hope everybody listening and watching can make use of it for their environment. Thanks, Lisa. Thanks, Doug.
Thank you,
Brady.